For the masseter muscle, as we learned, it usually refers into the teeth. It can refer deep into the TMJ joint, the eyebrows, and it could also lead to tension, headaches. Now, there are deep and superficial layers to this muscle. So to palpate it, I'm going to get the client to relax. My fingertips are on both sides around this area here, and then I'll get them to clench and relax. And once again, this is a good assessment to see if one side feels like it's firing a little bit more, if it feels like there's more excessive tone on one side or the other. It's just good to know before you go in and start massaging. So for this technique, when you're on the outer surface, you're just palpating, and you can do some nice circles, which is just nice and relaxing in this muscle. You can use 2 to 3 fingertips. I tend to like to use 2 fingertips. And with this one, once again, you could do a reasonable amount of pressure. You don't want to aggravate anything, but it doesn't have to be that gentle because this is quite a strong muscle. And let's say you find a trigger point. Once again, you could hold there for 30 to 90 seconds or however long it takes for the referral pain to dissipate. And you could slowly ease off. You can take a hot towel, place it on the jaw, which is really, really nice after you've done that. And you could also do a outer oral pin and stretch or myofascial style release. So I will pin right here towards the top of the muscle, towards the cheek, and then I'll get the client to slowly open their jaw. And as they're doing that, I'm just pinning the muscle down, and then they can slowly close. With this, I'm not using any oil, so it's more of a myofascial style technique. Now, another way to do this is hook in towards the top of the muscle, and then as they open, you can follow it and stretch the masseter as it's opening, which is a really, really nice technique that feels really good. It really helps to open up that area and range of motion around the TMJ joint after working the temporalis and the masseter. So once again, you hook in on the top of the masseter and then get the client to slowly open their jaw. And as they do that, you're stretching through the muscle all the way in to the angle of the mandible. And bring them back. You could also start lower towards the lower portion of the muscle, get them to open, and as they open, you're pulling upward along, which is typically a little less comfortable, but it's nice to work the fibers in different directions. Now, for the masseter, you want to work outside the muscle. Now, if that isn't sufficient and the client still has pain, a really, really good way to go about this, even though I know some people don't like to go intraoral, but if you are willing to and the client's willing to, they can accept it and they're comfortable with it, then you can use one glove and do a pincer grip on the masseter. So I'll get the client to slowly open their mouth, and then I'm kind of going towards this way. So it's really easy to feel. You kind of enter with this fingertip and you feel the masseter quite easily. And then what you do here is you can get them to close so you're safely away from the teeth. And I'm just providing a pincer grip with my thumb and my pointer finger. And because this muscle is pretty sensitive, especially when you're going intraoral, you actually don't need to do a lot. You could just sit here with your index finger on it and your thumb on the muscle, and it's just gonna slowly relax if you just move back. So you're just moving back and forth slowly, just easing in, very, very subtle. And this can take a couple minutes. So you really want to work with the client here and make sure they're relaxed. And after a couple minutes, usually after about 3 to 5 minutes, if it is really, really tight, it could take a little bit longer. So potentially it could take between 3 to, I would say, 8 minutes for it to relax. And you're just holding that pincer technique. And once you feel the masseter kind of like, it kind of eases down, and you'll feel this kind of melting away, and the muscle kind of melts almost downward and retracts. Once that happens, you can slowly release your grip, slowly bring your hand out, and then get the client to open and close their jaw and see if they feel like they have better range of motion.